Welcome to OAV's second video podcast, an addition to our intensive webinar program. Each month, we invite great guest speakers for a virtual discussion on crucial topics for German-Asia business relations. The second edition is an exclusive expert talk on the healthcare industry in India, jointly organized by the Confederation of Indian Industry, Spectaris, and OAV. Before introducing our two speakers, a few quick notes on the current situation in India regarding the COVID-19 pandemic. With 166,000 registered infections and 4,700 deaths, India is among the 10 hardest hit countries worldwide. And it ranks since this week fourth after US, Brazil, and Russia in terms of daily increase of cases. This indicates that despite very strict lockdown measures introduced on the 25th of March this year, hospitals in India will still have to cope with very high numbers of infected patients coming in the coming weeks. Since the immediate devastating consequences of the nationwide shutdown on the population, especially millions of migrant workers and all aspects of the economy, President Modi introduced on May 12th a massive COVID-19 relief package equivalent of 10% of the GDP. The long-term impacts of COVID-19 in India are still yet to be seen, and analysis vary very significantly. Surely, a significant part of the next relief measures by the government will be allocated to strengthen the healthcare sector. This, of course, triggers also questions about the future potential of bilateral trade and business links between Germany and India, especially in the healthcare sector. And this is the topic of today's talk, where we're very delighted to have two speakers here from us, from India and from Germany. At present, Germany and India only have very small business activities relative to the potential. 250 million US German exports and 50 million US Indian exports. So there's clearly a lot of room for improvement going forward. Our two speakers here today are two experts in the healthcare industry. We have with us today Ms. Kamineni. She is the Executive Vice Chairperson of Apollo Hospitals Enterprise Limited and a member of its founding family. Apollo Hospital is the pioneer of private healthcare in India and is Asia's foremost integrated healthcare conglomerate. She heads Apollo Pharmacy, which is India's largest pharmacy chain, and has a pan-Indian network of 3,800 stores and employs about 27,000 employees. She was also founder and chairperson of Apollo Munich Health Insurance, acknowledged as India's best specialized health insurance company for the past 9 years. She's a lead director in Apollo's research and innovation activities. Furthermore, she has been an active member of the Confederation of Indian Industry, and she's appointed as president in 2017 and 2018. As the first ever woman to hold this position since the inception of the organization in 1895. With us here today from Germany, we have Jörg Meyer. He's a communications specialist and has joined the German Industry Association Spectaris in 2018, which serves as a membership organization for more than 400 companies, representing industries with a total turnover of 70 billion euros and more than 300,000 employees in Germany. Spectaris is the German voice of optics, photonics, analytical and medical technology. We're very happy to have both of you here with us today for our video podcast. May I ask the first question to you, Ms. Kamineni? Yes. India and Bangladesh were hit very hard last week by the cyclone Amphan, which especially hit the Bay of Bengal very severely, as it was the strongest storm ever recorded in that area. The coronavirus restrictions of the lockdown that I just mentioned had been hindering evacuation and emergency and relief efforts. Prime Minister Modi also visited the devastated areas around Calcutta and the coastline and promised also support for the population in these regions. How was your company being involved and affected maybe also by this cyclone? And how has your company organized support emergency actions under these challenging circumstances? And how is the situation today in West Bengal and Orissa a week after the cyclone hit the area?
It's afternoon here, so good afternoon to everybody. And just want to tell you that it's June days. It's nearing June, and we are in the last. We're in the 70th day of lockdown, the world's largest lockdown here in India, and we're thinking that it will end in a few days. But what will June bring? But before we could think of that in terms of the pandemic, a cyclone of the magnitude that has never hit India and the Bay of Bengal in the last 200 years hit Orissa, West Bengal, and parts of Bangladesh. During that time, it hit it in the evening. So while many people had been pre-warned, they had stayed at home. If you see the loss of life, it's much less than would have been normally expected. But in terms of infrastructure, more than 5,500 trees have been uprooted. Actually, 10 million people were affected. Their homes were affected. There was flooding in many areas. And one of the most vulnerable is the electricity system. So that went out, including near our hospitals. But we were quickly organized. And the roads, even though there was flooding and immense winds to the tune of 180 kilometer speed winds, we were still able to manage this and with minimum disruption. So I think that the efforts have paid off. We're pretty much close to normal. In both states, we have hospitals in Orissa and in West Bengal. West Bengal, we were hit much harder. And we were there to provide relief efforts. The government, of course, did most of the work, and the army came in. So I think that that went off. And it's surprising, actually, to tell you that in these times, a hurricane of that magnitude would have occupied every single news channel around the world, and especially all the social media, to every media channel in India would have spoken about nothing but that for the last week. But all we had was the pre-warning and actually what hit. And after that, it's back to the main subject of COVID, because as I had mentioned, India now is the 9th largest number of COVID affected people, 150,000 people. We know that as lockdown is being eased, that the cases are going to rapidly go up. First point is that if we had not done this caring for lives over livelihoods, big challenge, big debate, India would have been overwhelmed. This pandemic would have just swept through this country, completely unprepared country. Now, day 70, I can tell you that the cases are limited to 13 cities, that the cases are limited to half the districts in India, out of our close to 800 districts, 748. Half of them have COVID positive people. The district level is being looked at. And I think that it's clearly shown that India is a federal, is while we're one republic, we're also a very federated kind of structure. So every state is working on what they're doing at a village level, at a district level, at a city level. And I do believe that things are going to get worse, but we should be able to manage them.
Yeah, thank you for sharing some insights about both of these crises that hit India very hard. Both the pandemic that is expected also from your side to still increase the facilities and the capability of the hospitals to deal with rising infections, and also the cyclone that has hit parts of India. The German healthcare system received internationally quite well rewards or recognition for dealing well with the first wave of the COVID-19 outbreak. How was this focus and surge of demand on the domestic market on one side, and restrictions on international travel and lockdown policies across many parts of Asia, and especially in India? How has that affected your members at Spectaris, Mr. Meyer, especially for companies that rely on direct contacts with hospitals or with other players in the health sector, who were then not able to travel or to support even their partners or clients?
Well, thank you, Mrs. Rösner, for this question, and thank you for inviting me to this podcast. And I'm also happy to meet you, Mrs. Kaminemi, even if it's only on screen. Yeah, thank you for those two questions, actually, that you asked. Number one focuses on the German situation, and I'll give you a short overview, very briefly, how we reacted on this pandemic in our, as we have 2,000 hospitals with 500,000 beds. So this enormous number of beds have been a big advantage when the pandemic started. We also have a certain and a big budget for dealing with this. Our health sector has an annual budget of 390 billion euros, which is 4,700 euros per capita, and 11% of the German GDP. So there's some stock in our bag to deal with it. During the pandemic, the number of ICUs, of the intensive care units, have been increased to 30,000, more than 30,000. Meanwhile, they are completely equipped with ventilators. And this means, and I think this is an interesting number, that on 2,700 German inhabitants, there's one ventilator. This also results of an action that the German government took even already in February, when they started to purchase huge amounts of additional ventilators at a very high speed. So we have been, without knowing it, quite well prepared for the pandemic, and now we got it more or less under control. But there are some major points on the downside. One is non-essential surgeries have been postponed in order to keep the capacities available for COVID-19 patients. There had been a shortage of personal protective equipment, which has been solved meanwhile, but still PPEs sell at very high prices. And there are some major frictions in market accessibility, in supply chains for our medical technology companies. There are stricter export regulations, even there have been some export bans. And the suspension of almost all air travel has led to a shortage in air freight capacities and in increased prices. So let me come to India. As India also closed most airports during shutdown, most of the products could not be delivered, or at least not in time. Freight capacities are limited and highly priced, and Indian exports and imports have decreased, as far as we learned it, by 60% due to the coronavirus. India has always been an important export market for German medical device. In 2019, we exported, as statistics say, 293 million euros, which has been a slight increase of 3% compared to the year before. However, it has some very specific challenges for German exporters. The market is segmented, it's regionally very diverse, federal, and therefore not easy to understand for German exporters. There are only few major national trade shows which cover the broad spectrum of medical device industry, and therefore companies need to invest a lot of time and resources to get in touch with doctors and with users of their technology. And additionally, the Indian federal system is a challenge for German companies, as the system and regulations to important medical products vary from state to state. So still, we think that German companies can be successful in the exchange with India, since we find well-equipped and high-performance medical facilities, highly educated staff, and demand for the state-of-the-art medical devices. And German companies are ready to deliver those things.
Thank you very much. Also, I think for our Indian audience, very interesting to hear what has been the activities in Germany dealing with the pandemic here, and also increasing the facility of ICU beds in Germany. Now, what have been the greatest challenges for your company, Ms. Kameni, in the healthcare sector in India in particular? And do you see now that from slowly, hopefully the lockdown measures will be lifted, there will be more possibilities for increased cooperation with providers from Germany, given now the experience we also have made in Germany to deal with India? Do you see any possibilities for German companies to also support India in the next needed activities to increase facilities and boost and strengthen the healthcare sector?
To be very frank with you, I think that as Maya had said, that supply chain disruptions are going to be the norm for the rest of the year. So it's going to be about how we can create areas of excellence and areas of scale within India. And I think for that, the CII, the Confederation of Indian Industry and German Industry, has worked for many years. So if you look at if you look at cities like Pune, for instance, there are nearly 200 German companies right there. So and if you in healthcare you have Siemens, and which has huge capabilities. So I do think there's a very great possibility of German companies doubling down on India as the base, because this is a place where not only for now, but for many, many years, healthcare is going to receive more spending. We realize that we've been spending far too little on building our healthcare system. We've seen this in stark, when we're staring at this pandemic, and we understand that we will not have enough hospital beds. We won't have enough trained people. We might not have enough ventilators. And I think this is the time that and it's not just the big companies, but we work with, in our hospital system, we work with many Mittelstand healthcare companies, which are excellent German companies. And I think that the opportunities for those that have a presence in India that maybe have been trading for many, many years should now think about putting down roots and firm roots in India to be able to manufacture in India, make those in India at prices that we can work with. Because just to give you an example, at the beginning of the pandemic, around the world, masks and PPEs were really very, very cheap. Actually, they were plentiful because it was all coming from China. And then all of a sudden, once the lockdown happened, not only did you see a shortage, but when this shortage was, overcome, the pricing was too high for companies to afford. And now, but then in this next wave, we've been able to make the prices also, whether it's masks. So we've been able to substitute. So my ask here is, at this particular time, not only for India, but for the world, this is the place that people must now double down on, to be able to come and manufacture here with great confidence. And that's what the government is going to start encouraging and moving towards. So I see huge amount of opportunities. And I do think when we had the JV with Munich Re, the health insurance, now that it's moved to Ergo, it was the fastest growing subsidiary in health in the entire Munich Re portfolio. So even in the services side, many opportunities in India.
Yeah, you mentioned the key term also, that the supply chain will change significantly also for the long run, and also I mean, we have felt it here in Germany that our dependency on maybe supplies for masks and other PPE from China, for example, was putting us at a certain risk. And I see also clearly, as you mentioned, there is a possibility and an opportunity for now India to be also a stronger partner for Germany, but also globally for other companies, both due to its strong domestic markets, but also due to your very strong capabilities to provide internationally health products. Also, for example, India is the largest producer of vaccines. So there's clearly already a significant role that India is playing, but of course this can even be increased. Where do you see, Mr. Meyer, the strongest areas where German companies should get more deeply involved in India? I mentioned previously that exports currently from Germany to India only stand at 250 million euros in the healthcare sector. Where do you see areas where German companies should have a closer look at?
Well, we have historical data on this, but I think this doesn't give the whole perspective on the future after Corona. If you look at the historical data, what Germany exported in the year 2018, we see a focus on appliances like breathing appliances, gas masks, massage appliances, testing apparatus, medical furniture. So these are kind of, well, I wouldn't say niches, but it's not the high-tech equipment. Still, there's more and more companies coming up delivering high-tech equipment like devices for ophthalmology, for orthopedy and diabetes. So this is still the historic status where we see companies like Zeiss, endoscopy companies like Karl Storz or Richard Wolf exporting to India. But I think that in terms of Corona, the whole surrounding equipment for ICUs, for example, is a very competent field of German companies, and we might export and deliver more, even in joint ventures with Indian companies. But if we look the way vice versa, concerning the imports to Germany, I'm sure that there will be a tendency amongst German companies to have second sourcing from India, not only from other countries. Of course, there are a lot of companies who are already sourcing as of today from India, but second sourcing will be the key, because we saw that in such globalized markets, it is highly critical if you only have one source and the supply chain is interrupted, especially if it's critical medical devices. You need to secure your supply chain by second or even third sources. This is nothing we think governments should prescribe by law. This is something that the market should develop by itself, and I'm quite sure that this will happen. Apart from this, there are certain fields and opportunities for more bilateral cooperation. Also in the IVD sector, which is also represented by our association, there is good initiatives concerning the Mittelstand, so the SME companies who are very interested in the Indian market. There are even programs like Make in Indian Mittelstand, which is promoted by the Indian government. We are taking part of this. And we also have to see the bigger picture, since we are basically not only talking of Indian-German relationships, but also Indian-European relationships. Germany is part of the European Union, which is the largest trading partner for India, accounting for 80 billion euros of trade in goods in 2019, which is 11% of the whole Indian trade. And I think in these fields, German business, European business, there's big potential after Corona to have more joint ventures, more bilateral cooperation, more import, more export.
Thank you. Ms. Kamineni, you're also in charge within your organization for innovation. Where do you see particularly opportunities to cooperate with German companies, both, let's say, as an example, within your own organization of Apollo Hospitals, or also on a broader scheme with other Indian partners, especially in growth segments like artificial intelligence, digital healthcare? what opportunities do you see for innovation in this bilateral cooperation? And are you aware of any programs that are now maybe in discussion and amongst the government to strengthen the healthcare system going forward after the experiences of COVID-19?
You know, I think that every crisis is a time where you have the period of the most of greatest innovation, and this is something that and it's something that because when you're pushed to the wall that you have to be able to create new solutions, and we saw that in healthcare. Really, this is the time that digital health, the ubiquitousness, the legitimacy of digital health, even in a country like India, and I say that that probably India will be one of the biggest models of moving towards digital health. Because we were anyway a mobile first economy. We skipped that entire computer revolution, and people, you know, the young people went from you know, just nothing to a mobile phone. And on that, when you have the 4G technology, and we could send digital health, and when there was a complete lockdown, the only way that people could communicate with their doctors was on using video consults. This is something that Apollo hospitals had done for many years now. We've done more than 10 million video consults, but we've done that more for the social sector, for remote villages, and you know, for distances that, you know, where you did not have access to a doctor. Now we have to do it in a real world setting on the phones that all our doctors within 45 days, we put nearly 3,000 doctors onto a digital video consult platform. And we've been doing this, so we have, we're doing more than about 2,000 consults a day. And with that, from medicine delivery to moving into to building more and more packages for them and how we look at digital health, I think that's where the innovation will really come in. What are the things that we can do with AI? How will we? How can we start learning fast and continuously making up, you know, upgrading improvements to make healthcare, you know, really so many things. We did a digital scan in 48 hours for COVID. A scan, 10 million people took it within a week. And now what's happened is that the next one has a version with a cough scan in it. And the cough scan plus this scan has almost an 80% you know, probability that you can pick up COVID. And I think many such innovations will happen. And I think Germany's really done a lot when it comes to home health. And you look after, you have a large aging population, and how you keep them out of the hospital system to be able to manage them at home. These are the things that India can actually put out at scale when we look at managing. And what it'll do is, even when there's no COVID, it'll be really useful to put taking pressure off the healthcare system. So what we've learned is a long-term solution to manage the ability of distances in India, that people didn't have access to care. Now with some of the home health, the digital health connected wearables, we can actually bring a hospital to homes and take it across distances, layer that with AI and clinical intelligence, and I do think that we can provide many solutions. So I think that this is the kind of innovation that can happen in India. And Germany would be a great partner on many of these.
Yeah, that is actually, I think what we all learned from this crisis is it's been leading to an increase of digitalization, both for the workplace, but also for ways of how services can be provided, and especially in the health sector. And you gave very explicit examples of how you have been doing this at Apollo hospitals. Very impressive what you've been able to achieve in such short time. Now, one challenging aspect right now, very practical, is Now, with this great potential in mind, how can German companies actually close partnerships with Indian partners right now, where there's still restrictions on traveling, fairs have been cancelled. So, Mr. Meyer, how do you foresee this potential can be materialized, given the restrictions and limitations that we're facing right now?
Well, let me answer your question first with the programs that we have already in place in Germany that encourage and support the Indian-German partnership in this field. So there are existing programs, and we will lobby for expanding them now in the process when Corona starts to decrease, or the effects start to decrease. So we have certain programs, for example, from the German Ministry for the Economy, which include dual vocational training. This could be used for training after-sales services technicians, and those could then become local service technicians for German companies. So vocational trainings is a key, and we would like to support it in joint projects between India and Germany. There's another project called Fit for Partnerships, also operated by the German Ministry for the Economy. This is also an element of Germany's foreign economic policy. The training prepares executives from 19 countries, and India is one of them already since the year 2008. And we should also invest in expanding this program too. And third, what I would like to mention is a special collaboration in special economic zones in India, the SEZs, where we could also pave the way for more bilateral cooperation. So this is something which we could push and improve, but there are also certain barriers for collaborating in the Indian healthcare sector, and I would like to name some of them because they are, we have to face it and try to work on them. On the one hand side, since the 1990s, the liberalization of the Indian economy has improved the conditions for trade between India and Germany. Many import regulations have been progressively eased. Almost all items are now allowed to import it to India. So this is the good side. But however, India's trade regime and regulatory environment remains relatively restrictive if you compare to other countries in the world. German companies in India still face a variety of technical barriers of trade, such as deviations from international standards and agreements, legislative and administrative hurdles, bureaucratic delays, and sometimes inadequate infrastructure and tariffs. Let me give you an example. The import tariffs for products such as instruments and appliances used in medical, in surgical, in dental or veterinary sciences, or in other electromedical apparatus and sightseeing testing instruments amount to 7.5% import tariff. The Bureau of Indian Standards demands that certain products fulfill the Indian BIS quality standards, which have now gradually come closer to international ISO standards. But from a regulatory affairs point of view, we can observe sometimes a lack of clarity and communication about the rules and regulations for medical devices. It is positively noted that the Indian government has started to regulate medical devices differently from pharmaceuticals, which had been one in the past, but considerably more work has to be done to harmonize the international handling of said devices. Moreover, the relatively low spending, as we see it on the healthcare sector, displays some barrier. As the globalized market offers a lot of competition, especially in price-sensitive markets, German companies need to compete with companies from other countries like China in public tenders, which sadly often focus on the price rather than other essential criteria too. It would be important for us to include the life cycle cost of products and the after-sales services into the criteria for awarding the public tenders. Some competing products might seem cheaper, but in the long time, investing in a more expensive product from Germany, as we think, which includes a variety of after-sales services, can be very well worth the original higher price. So I think these barriers should be tackled jointly also in a kind of political dialogue. But if we look at the very close and immediate next steps, I think we can easily intensify the collaboration between German and Indian companies to become more active in trade shows, in delegation visits, and Corona-like in using online technology like this to get in touch more easily.
Yeah, there is certainly still a long list of challenges that I am sure the AHK office, as well as the European Chamber of Commerce in India, is also advocating for improvements to ensure that foreign companies, especially German companies, have a better market access in India. Maybe to come to an end to our video podcast, Ms. Kamineni, do you have any particular tips that you would like to give to German companies? Any suggestions of what they should be aware of when they want to enter or expand their activities on the Indian market, that makes their success quicker? Or now, given the changes of the setting, new budgets being set, new priorities being set in the healthcare system, German companies should be aware to ensure that they can be successful in India?
You know, I'd like to leave you with one last quick point, that this virus has really set the world back by 3 trillion, and India alone before was not looking at a degrowth, but now is. And having said that, you will see that the level of savings has gone up. People have become a lot more cautious. So while it's important that people will take care of their health, they will be very, very careful in seeing that they get the best value out of every rupee they spend. So I think that the tip that I would give you is that we probably want that we will still love your Mercedes and the BMWs, but there will be a class of people that will want mobility at a great price. So it's the same thing, that there will be people who can afford the best of healthcare, but there will be many, many, many more Indians who will need value in that healthcare. So whatever there is that we can deliver value are the ones that will completely succeed in a country that requires it as much as India.
Yeah, thank you for this. I think within the short time of our video podcast, we could cover a lot of different topics, starting with the current situation in India, given the coronavirus spread. We really hope that the number of cases will not go up much higher, and that now with the lifting of some of the lockdown measures, the numbers are not increasingly too much. We also heard about the opportunities that now will arise in the short term, providing ICU units, facilities of dealing with special patients, but also in the long term, cooperating more in innovative fields like digital healthcare, and using the great knowledge and the experience that already is available in India in these fields. Of course, we also touched upon challenges, which is one area or the area where market entry might not still be so easy for a lot of Indian companies. We know that at OAV, India is not an easy market for German companies, and we very hope that with seminars like this, we can highlight these challenges and also then contribute to a discussion also then later on when this is possible on a governmental level. And there are frameworks that are well established between India and Germany to address these issues also on a governmental level. I would like to thank you both very much for spending the time with us here today on this video podcast, which we will also then share amongst the different organizations that have been involved in making this possible. Special thanks again to the Confederation of Indian Industry, as well as to Spectaris. We will also be available for those of you who would like to have additional questions being answered. And we'll see now the contact details of our 3 organizations that have been organizing this video podcast. We thank again the Confederation of Indian Industry and Spectaris for joining us here today and making these 2 excellent speakers available for this video podcast. Of course, at OAV, we also like to see you again at some of our upcoming webinars. For example, in mid-June, towards the end of June, we will have our country committee meeting on India. This will take place in a digital format as well. And we very much look forward to welcoming anyone interested in learning more about the bilateral exchanges and activities between Germany and India. With that, I would like to thank all for your interest in joining our video podcast today and look forward to seeing you very soon, and stay please in good health. Goodbye.